Update by Dr. Aimee Sisson, and we've got her on the line.
Dr. Sisson, are you there?
I'm here.
All right, go ahead.
Can you bring it closer?
Okay, good morning. Thank you, Madam Chair and members of the board, for the opportunity to provide an update on the coronavirus outbreak in Placer County. Since I last provided an update to the board 2 weeks ago, the number of confirmed cases of coronavirus disease, or COVID-19, has continued to rise. 2 weeks ago, there were 24 cases of COVID-19 in Placer County. As of this morning, there are 115. The number of cases is doubling approximately weekly. 3 Placer County residents have now died of COVID-19. Of our active cases, 7 are hospitalized and 3 are in the intensive care unit. Several have a poor prognosis and are likely to die from their disease. You've likely heard much discussion about outbreak models and disease projections over the past 2 weeks. In entering our local data into publicly available models, I've seen just how inexact the science of modeling is. The output of a model is only as good as the inputs and the assumption that the model is based upon, and there is so much we still don't know about this new virus. Using one set of assumptions, one model predicts that the number of hospitalizations in Placer County will peak in May, and using another set of assumptions, the same model predicts a peak in August. As we all know from our own lives, predicting the future is hard, and that is exactly what these models are trying to do. One thing that is true in every model is that the number of new coronavirus cases, hospitalizations, and ICU patients in Placer County each day will continue to rise to a peak and will then eventually decrease again. The height of that peak and the timing of the peak are different in every model. Models being used by state-level public health, Models being used by state-level public health officials predict a surge that will exceed the healthcare system's capacity in May. Models from the University of Washington are much more optimistic, predicting a peak in mid-April that is within the healthcare system's capacity. Our public health team is taking the approach of planning for the worst while hoping for the best. What does such an approach of planning for the worst look like? It starts with hospitals implementing their healthcare surge plans. These plans involve increasing the number of total beds, ICU beds, and ventilators in our hospitals. One of our hospitals has a 7-phase plan that would more than double the total beds available to treat sick people. Planning for the worst case scenario also means planning for what to do if this expanded hospital capacity still isn't enough. This might involve providing home care consisting of oxygen and telemedicine to moderately ill patients, or sending patients to the planned 400-bed field hospital at the former Sleep Train Arena in Natomas, or even setting up another field hospital at a Placer County Fairgrounds site. Again, we don't know if these options will be needed, but if we don't get them ready, we won't have them available as an option should they be needed. The virus that causes COVID-19 is a challenging enemy. Since my last address to the board, we have learned something new about the virus, something that makes it even more challenging as an enemy and more difficult to control. We now have evidence from China, Singapore, and Washington State that people can spread the virus up to 3 days before they develop symptoms. It may also be possible that some people, perhaps even half of people who are infected with the virus, never develop symptoms, yet are still able to spread the virus. We can no longer assume that people who feel fine aren't infected with coronavirus. The best way to control a virus that can be spread by people without symptoms would be to test everybody to determine if they're infected. Unfortunately, our testing capacity remains limited. At the moment, we don't have the capacity to test everybody with symptoms, let alone everybody, period. There is testing hope on the horizon, with a rapid test from Abbott expected to be available in Placer County in the next week. Sutter and Kaiser's laboratories are already able to provide test results in as few as 8 hours. An antibody test was just approved by the Food and Drug Administration. So while there is reason to be hopeful, widespread testing remains a goal, not a reality. Our current reality is that our best tool to slow the spread of the deadly coronavirus is to stay home. By staying home, we reduce interactions that could provide an opportunity for the virus to spread. Staying home is hard. Humans are social. We don't just want to interact with others, we need to. But for the time being, we must settle for in-person interactions that are limited to our household members and virtual interactions with everybody else. We long to return to our pre-coronavirus lives, to normal. I get it. The economic devastation caused by staying at home is very real. Yet we must continue to stay home. If we do not, each person infected with the virus will transmit the disease to more people, and the total number of cases will increase faster than the healthcare system can keep up with. People who might have survived had an ICU bed and a ventilator been available will die unnecessarily. A minute ago, I talked about how the outbreak models are based on assumptions. One huge assumption is that people stay home. If we don't stay home, the peak will be higher and it will be sooner. How are we doing at staying home? Not great. A company called Unicast has analyzed how Americans have been doing about staying home based on cell phone mobility data, and the results are disappointing. The US as a whole has earned a C-. California as a whole is only doing slightly better, earning a C. Placer County has also earned a C. This C represents a 40 to 55% decrease in distance traveled and a 60 to 65% decrease in non-essential visits. We have to do better than this. We have to stay home as if our lives depended on it, because they do. In addition to staying home as much as possible and staying 6 feet from other people when we do have to leave our homes, last week I announced a new recommendation for all Placer County residents to cover their faces when leaving their homes, using either a homemade cloth mask, a bandana, a scarf, a gaiter, or some other item that covers both the nose and mouth. The purpose of these face covers is to protect others from the person wearing the mask. The recommendation is an extension of my prior recommendation for sick people to wear a mask. Only now we can't use symptoms to tell who is infected with the virus. All of us could be infected and not know it yet, so we all must cover our faces. This is a community-oriented act. Many members of the public are contacting my office and wondering what they can do to help our community during this challenging time. You can start by wearing a face covering when you have to go out. Your face cover protects me, and my face cover protects you. In no way is a face cover an invitation to go out more often. Staying at home remains the best way to protect yourself and others from coronavirus. On March 19th, I issued a directive for Placer County residents to shelter in place at home except for essential activities. This directive went into effect on March 20th and ends on April 10th. Since that time, California's governor issued an executive order for Californians to shelter in place that continues until further notice. The existence of a county-level directive and a statewide order that are similar but not identical has been a source of confusion over the last 3 weeks, especially as it relates to essential activities and essential businesses. To reduce confusion, I intend to issue a health officer order later this week that will preempt the statewide order whenever it is more stringent. The order will also clarify much of the ambiguity about which businesses are considered essential. The order is still under development, but you can expect clarifications to be provided about parks and outdoor spaces, outdoor recreation, funerals, construction, landscaping, and real estate. Until then, I urge residents and businesses to focus on the intent of the directive, which is to stay home as much as possible, rather than on exploiting loopholes. Every loophole exploited is a hole in the wall that is holding back coronavirus. Too many holes and the wall falls down and coronavirus spreads widely. If you are an essential business, you still need to adhere to the 6-foot distancing requirement, for example, as well as stop any non-essential aspects of your business.
Dr. Sisson, do you have just a moment? I think you're on speakerphone. If you can pick up the handheld phone, that might make it easier for us to hear.
How's this? Okay. So the world is facing a challenge greater than most of us have ever faced. The coronavirus pandemic has given the entire world a common enemy. Please do not forget that the virus is the enemy, not each other. If we're going to get through this challenge, we must be kind to one another, help our neighbors, and share our resources. We are stronger together, and we will get through this if we stick together. Thank you.
All right, thank you, Dr. Sisson.